Mornings in the ER, honestly, I don't think about them as much because when you go in the morning, no matter how much you think about it, it's unpredictable. You could walk into a storm or you could walk into calmness. You can't predict how it's gonna go. So you take it as it comes. So this has gotta be bad if they're asking us to go to the helipad. I haven't had to go to the helipad before. Usually they come to us. Patients often arrive by helicopter onto our helipad, which is on the 5th floor of the hospital parking lot. This particular situation was unusual because I'm staffing the entire emergency department and it's rare that you get called out to the actual helipad. And when Andrea told me they were requesting us at the helipad, I found that very strange. I am standing in the elevator waiting for it to go from floor to floor to floor, and I am just not used to standing still like that. Time is precious in the emergency department, and Andrea and I are taking care of many patients along with the rest of the team. And here I am standing on a rooftop waiting for a helicopter to arrive when I know there's a lot of patients who need help in the emergency department. This is killing me. I turn around and there's a handful of towels because I'm being told that this patient has an extreme amount of bleeding. I've put on this gown thousands of times, but here we are in a situation with a 30-mile-an-hour West Texas wind, a chopper arriving, and it's amazing how something you've done thousands of times can be this challenging when you need to do it quickly. I'm Sudeep Bose. After serving 15 months as a frontline combat physician in the deserts of Iraq, I came back to the United States. And now I'm treating casualties in a busy trauma center serving one of the most brutal environments in the world, the desert and oil field of West Texas.
Drop 100 of socks, drop 0.5 of atropine.
Where crisis knows no boundaries and chaos knows no limits. Whenever you hear those blades, I always associate it with a patient coming in and someone who needs a lot of help, whether it's in the deserts of West Texas or the deserts of Iraq. Morning of November 24th, 2004, Fallujah, day before Thanksgiving. I'll be in this field ambulance, and today we will see the streets of Fallujah. Home sweet home. Hi, Mom, Dad, sister. These are all holes from a mortar round.
And the infamous Sudeep Bose.
I served as a battalion surgeon in Iraq with the 1st Cavalry Division during Operation Iraqi Freedom. I served 12 years in the military, and in our unit with the 1st Cav, we were very forward. And what that means is there's the hospital. This is the combat support hospital. But we were frontline to the hospital. That's where the mortar landed. And I was told that a VIP patient would be arriving. This is where I saw a very special VIP patient. It was Saddam Hussein.
Hussein was found hiding in an underground crawl space at 8:26 p.m. Soldiers captured him without incident.
He was hiding in a crawl space, a spider hole, the military called it.
A dark and painful era is over.
They cleared the area, except a few key personnel remained, and the chopper landed. I could hear it coming, and when it landed, I noted that out came 6 armed men, armed to the hilt. And they exited the helicopter outside an elderly man in a wheelchair, disheveled, and he was blindfolded and restrained to the wheelchair. I'm face to face with the man who'd ruled a country into ruin and was responsible for the death of thousands of people. And he looked at my weapon, which was on my side, and muttered something in Arabic, and you could feel the tension. I introduced myself. I'm Dr. Bose. And I began his medical care. I did not want to be the US physician selected to treat Saddam Hussein and miss a critical diagnosis on him. I examined him from head to toe. The room we actually examined him in was used for OBGYN patients because not only were we in combat, we were treating the local population for humanitarian reasons. And this was the most secure room at the time. We actually had a little bit of conversation, and it was all through an Arabic translator. And there are parts of this, parts of the care I'm allowed to talk about, and parts of the care that I'm not allowed to talk about. But I exited the room like I exit any other patient's room. In television, things happen so quickly, but in real life, things happen a lot more slowly. A helicopter landing with a patient is a slow process. You have to wait for it to arrive, you have to wait for it to land, and most importantly, you have to wait for the blades to stop spinning before you approach the patient.
Wait.
Yeah, watch the blades. All right, so what happened?
So car hit another car, went into a building.
Which one was he, this car?
He was this car that went into the building.
How much blood loss have we had? Can you guess? Like, what's that? Liter. So he's maybe lost a fifth of his blood volume. I'm waiting for the medics to take the patient out. And while this process is going on, my brain is spinning. I'm thinking, do I see any major bleeding anywhere? I'm thinking, is there anything immediately I need to address on this helipad right now? What's the lowest blood pressure, highest heart rate? I'm going through a million things, and I'm leapfrogging to all the things that need to happen. Was he ejected? No. It seems that they've controlled the bleeding for now, which is a good thing. So there's nothing I'm going to need to do immediately, and I won't need those handful of towels. This patient is critical. You need to be in control of the situation, and we can do a lot more harm if we rush and injure the patient more when going from the helipad across to the emergency department.
He had like over 1.5 feet of intrusion into the cab. I have pictures, I'll show you when we get there.
Here, let's push him over and get him onto this board. I've got C-spine precautions.
His body all the way?
Yes. There. Okay.
Yep.
So you're calling him GC, he was combative the whole time?
Yeah, but GCS like.
And then you guys intubated him?
Andrew's EMS.
Andrew's EMS.
But we were there when they were doing it.
His stats have been okay?
His stats have been.
So 102 systolic is the lowest blood pressure we've gotten.
Got a 92.
92, okay.
Watch out.
This patient is unconscious, not verbal, and has minimal movement. And the highest heart rate you got?
150.
150. Okay. The most dangerous thing about this whole ordeal is crossing the street to get to the hospital. Possibly more dangerous than the chopper ride over here.
It'll be a little while.
Go ahead and give your report. All right, everybody listen for AeroCare report.
Okay, dispatch to a scene on Telephone Cove Road going toward Andrews, about probably 10 miles out from here.
When I hear Oilfield Road, I think, here's another trauma from one of the most dangerous places in America, the oil field in West Texas. People are coming by the thousands to this area for jobs. This oil boom is the biggest in America right now. Truck stops and man camps popping up everywhere. You see signs saying help wanted, jobs open, people madly looking for workers. And the roads, they don't change overnight. And with all the incredible growth and prosperity comes a deadly side effect.
For some reason he left the roadway, embedded himself into the mobile home.
And what do we know about the patient?
He's dead.
He's dead. Permian Basin has the highest traffic fatality rate of any place in America. What you got?
Oh, who just touched my leg? Okay. Oh my God, please don't touch that foot. Oh my God, that hurts.
We're gonna move you over. We'll give you some pain meds, okay? People have a hard time wrapping their mind around this. Our trauma center, Medical Center Hospital in Odessa, Texas, is the highest level trauma center for 38,000 square miles, roughly the size of the entire state of Indiana or Kentucky. All right, we're gonna need a few people to roll just to stabilize that leg and then roll. As busy as we are at Medical Center Hospital in Odessa, I find the time to work emergency room shifts in the town of Fort Stockton, Texas, at Pecos County Memorial Hospital, basically out in the desert. Pecos County Memorial Hospital is the only emergency room for 226 miles of Interstate 10, the longest stretch of the fastest highway in America, and 246 miles from the Mexican border all the way up to Medical Center Hospital in Odessa. Fort Stockton hasn't really changed that much since 1871. It's the same spirit of rugged individualism, stubborn determination, and untarnished optimism. You need that spirit when you're trying to make a living in the desert. Are you allergic to any medicines? Español? Okay. Me llamo Dr. Bose, okay? This is not a trauma center. Actually, Medical Center Hospital in Odessa is where we send patients after we stabilize them in Fort Stockton. So we've arrived on the chopper, we've crossed the street, we've made it to the emergency room. The next step is to transfer the patient from the EMS stretcher on the backboard to our hospital bed in the emergency room.
1, 2, 3.
ABCs, guys. In trauma, you cannot lose track of the ABCs. Airway, breathing, circulation. Because if you get distracted by a bone sticking out or a big laceration, you could miss something more critical that can cost a patient his or her life. As far as blood loss, they said he lost about 1 liter on the scene, so maybe 1/5 of his blood volume. Dr. York is the trauma surgeon, so if the patient needs to go to the operating room, he takes the patient to the operating room from the emergency department.
2, 3. Great.
He's got about a 15 centimeter U-shaped laceration, avulsion, entire down to the bone. I'm not palpating any fractures. Luckily, we've stopped his bleeding, so I order a LAC kit, which is a laceration tray to repair the laceration. And we'll do this after he returns from CT scan. Okay, we got sliding lungs. Go to CAT scan. Our patient goes to CAT scan, and I know I have a lot of work left to do on him. But in the meantime, EMS has delivered another patient to trauma room 5.
Bystander said she didn't get ejected. They said she got out of her vehicle after a roll, walked 20 yards and fell to the floor.
Okay. What was the lowest blood pressure and the highest heart rate? This is a one-car rollover. No other vehicles involved. GCS 15. This is strange in the flat lands of Odessa, Texas. Hola, me llamo Dr. Bose. ¿Dónde tiene dolor? This patient's Spanish speaking only, so I'm having to reach back to my high school Spanish from Naperville Central High School, outside Chicago, Illinois. ¿Tiene alergias de medicinas? ¿Toma medicinas? Let's get her off the backboard.
Okay, ready? 1, 2, 3.
¿Dónde duele? ¿Dónde? Okay. I have to figure out why a patient rolled their car without any other vehicle involved. I often think of the S's. Did she fall asleep? Did she have a seizure? Did she have a stroke? Was she suicidal? Was her sugar low? Sauce is my mnemonic for alcohol because I needed to fit it into my S's. In the middle of the chaos, in the middle of taking care of this patient, the state trooper asked for a blood test, and then I knew there was probably something going on. Hey, how are you? While we sent the rollover victim to CAT scan, and the blood has been sent to lab at the request of the state trooper, I go see an elderly gentleman. So what happened?
I guess he lost grip and fell straight back on the ceramic floor.
Okay.
He hit the back of his head.
His daughter is actually a physician assistant. And I know she's going to be a great help during my assessment because she knows the medical lingo. Okay.
He had a fall exactly 3 years ago, and he ended up having a compression fracture in the T-spine and the L-spine, but he only had the kyphoplasty in the L-spine.
Okay. As I see this gentleman, he reminds me of a lot of people in West Texas. Hardworking, he's fiercely independent. And as he's aging, he's having a hard time letting go of his fierce independence. Do you feel like you broke your back? Have you ever broken any bones?
Dice que si siente que se quebró la espalda, Dad.
No.
It's hard for older people to give in to old age. Can you sit up?
Siéntese, Dad. Que se siente.
Okay. I think he'll be okay, but just to be safe, I order a CAT scan.
Is that new?
And speaking of CAT scans, the CAT scan for the rollover patient has returned, along with their blood tests. Hey, how are you? What's going on? Hi. Hola. No tiene fracturas. No hay nada quebrada. There are no broken bones, but the state troopers have some bad news to give her. Thank you, guys. We may be discharging her from the hospital, but she's not going home. She's probably going to be very sore for quite some time. And that is not going to be easy in jail. Once again, it comes down to choices we make in our lives. And this is a choice she's going to have to live with. In a way, she's lucky. She's going to jail, but she could have been headed to the morgue. Our car accident patient is back from CAT scan, but we have to close up the laceration on the back of his head before he goes to surgery. Blood pressure gonna tolerate propofol? It looks like it is. Propofol is a medicine that is for sedation, and it's to prevent the patient from fighting the ventilator in this case. It's not comfortable to have a tube in your lungs to help you breathe, so it requires a lot of sedation. See, he's still bleeding through here, so we gotta just close this lab. His face received a lot of the impact. Multiple facial fractures. And our job here is to close up the scalp, which is partially ripped away. The trauma surgeon begins to cut away the hair at the back of the head, and the more the hair is removed, the more injuries we see. And I realize this is going to require a lot of staples.
Really well. We're going to close this temporarily so that,
Give me the antibiotics.
at least we get the bleeding controlled.
Yeah. Thank you.
Keep doing that.
We have just more irrigation, please.
People are always amazed when I say this, but notice that you're not seeing any alcohol, any peroxide, or even any soap. Alcohol and peroxide, they're strong. They kill bacteria, but they're too strong. They kill the normal healing tissue as well, and it can delay healing. Here in the trauma center, we just use good, clean saline. That's all. And it surprises a lot of people to hear that, but it just gets the job done.
Juan, what are you running on here?
That's the clindamycin I did run.
A lot of exposed cartilage.
You need the lighter with
We'll
that?
inject it with Lido with Epi. Yeah, Lido Epi.
1316 clindamycin started.
I'll let you get that angle. I'll let you get this angle. Although he's sedated with propofol, that makes you sleepy. It doesn't necessarily work on your pain. So I must remember when someone's sedated, I also want to keep them comfortable. So we inject with lidocaine. And I didn't get this wall here. I got this wall here, you get this wall going up. This requires a series of injections right there where the laceration is. Stapler. All right, we might want to lighten on the propofol a little bit. All right, first staple. Staple 2. Staple 3.
On the pink part.
Staple 4. Staple 5, 6, 7, 8, 9, 10. This was an irregular laceration. It was weird. It was jagged. It was going in different angles. 15 staples to top laceration.
15.
1, 5. So we needed one person to actually hold the ends of the scalp together while I placed the staples. Total of 22 staples.
Got blood yet?
Andrea Sanders.
You know, if it takes them that long. There we go. No, that's good. We just got it. So let's get his blood in. Give him 2 and 2 right now.
22 staples placed, and then we have to keep the wound area clean. And there may be continued drainage from there, so we wrap the head in gauze.
Very good, everybody.
All right, grand total 22 staples. Thanks for your help. He has a lot of surgery ahead of him. He has a lot of evaluations ahead of him. He has a lot of healing ahead of him. But we know that we gave the next set of doctors a stable patient who they can take care of. All right, thanks guys, appreciate it. Hi, I'm Dr. Bowles, nice to meet you. It's the end of my shift when I'm sent into the room to see a little boy with a neck injury.
I came back out and he's like, just tears coming down and that silent cry, like when you know it's bad.
And there's a cricket
Well, he thinks there's a cricket in his neck. That's what I told him.
right there.
You got a cricket in your neck? What happened? How did that happen?
Because I fall down off the couch.
You fell down off the couch. This boy heard someone say he has a crick in his neck, but I can tell immediately that he's not in critical condition. Let's place him in a cervical collar if we have one his size. We'll mobilize it. Our biggest concern with any neck injury is the spinal cord goes right down there, so we're extra cautious. We're gonna put him in a collar. A lot of times it's just muscular and he's got a spasm. I don't think it's much more than a sore muscle, but I'm sending him to CAT scan to be sure. When I stopped to think about it, this was a kind of busy day, but this is par for the course when you're the highest level trauma center for 38,000 square miles. Hey, one of our fellows in training, Guillermo, says that the CAT scans look good, nothing broken, and I guess you figured that out because you took your collar off, buddy, and you're eating Cheetos.
The nurse said it was good, he was starving to death, so I was
You hungry, huh?
letting him have something to eat.
How the Cheetos? Good? 2 donuts. As much as I hate to admit it as a physician, it is amazing the healing capability of a bag of Cheetos and 2 donuts.
Can we go now?
You ready to go, aren't you? It is great to see a happy kid with no serious injuries. The accident patient who came in by helicopter is in surgery now. He's stable and he should make a good recovery. My former colleague's father will go home where he's supposed to be with his family. The girl who flipped her car is not so lucky. She's in the county jail. But let's hope there's a lesson that helps her make better decisions in her life. Good job. We are done. We're done.
We're done.
After a challenging day like this, I step back and I think how lucky I am to be part of an incredible team, whether in Odessa or in Fort Stockton. A team like this that you will not find anywhere else. This is West Texas.